Assalamu alaikum. In this video, we are going to discuss about the ENT's Ospe, and this is my second video on ENT Ospe. And in this video, I am going to discuss about the ear instruments. Okay, so let's start with its first instrument in front of you. This instrument is okay. So two to three main features that you must know in order to diagnose an instrument is that here you can see that in this Myringotome, here it is its handle and it has a tip, and on its tip there is somewhat triangular blade and it has a curve in its neck. Okay, so these are two to three features that you must know in order to diagnose a Myringotome. And what is its use? It is mainly used for incising the tympanic membrane. Okay, in the case of if there is any suppuration in the middle ear and we want to drain that suppuration, so we give incision in the tympanic membrane and we drain that suppuration. Like in the case of one example of Myringotomy is that we do it in the case of suppurative otitis media. Okay, so here number two is like here is shown that it is the Myringotome, and this is the tympanic membrane, and we are giving incision here in the anterior inferior quadrant. Okay, and here are two types of incisions that we can give in the tympanic membrane. One is a circumlinear incision and the other one is radial incision, but here we are not discussing that, so let's move forwards. Next instrument that is shown here is this is Jansen Mastoid self-retaining retractor. Okay, remember that it has this type of coin type of handle to hold it, and it has two screws here by which we can adjust its prongs to our desired extent, and on its prongs, at each end of its prong, there are three teeth that can be seen easily. Okay, as its name indicates that it is used for mastoid retraction, so it is mainly used in mastoidectomy. Mainly, almost all the instruments that I will show you here are more or less used in the mastoidectomy. So it is asked in your exams many times that write the diagnose the instrument and write its uses, and after that they ask that what are the indications of the mastoidectomy and what are its side effects. So you must remember that as well. Okay, so its main purpose is that we use it for the purpose of mastoidectomy, or we can say that in any type of mastoid surgery this instrument is required. Like here Jansen mastoid self-retaining retractor, I will show you later. Mollison's mastoid retractor, that is also required in case of any type of mastoid surgery, and mainly for mastectomy as well, and they are also required in the case of head and neck surgeries like tracheostomy and laryngofissure, etc. I hope so this will be clear. Let's move forwards. This is another picture of Jansen's mastoid self-retaining retractor, this one. Okay, and then here is actually the Lemperts and oral speculum. Lemperts and oral speculum actually has two limbs, one this and the other one is this, and these two limbs then join together upward and form a somewhat curved structure. Okay, and this curved structure then ends in this hollow cylindrical tip. Here is another Lemperts and oral speculum. You can easily see here that here is a screw and its two limbs, and these limbs then end upwards into curved plates, and here is hollow cylindrical tip. And but you must differentiate Lempert's and oral speculum from Killian's nasal speculum, which has long blades. You can see here that it has long blades right here. But in the case of Lempert's and oral speculum, it doesn't have so much long blades, right? And then comes the Lempert's and oral retractor. Here you can see that it also has three blades. These two lateral blades are mainly used for the retraction of the tissues. Okay, and then this third blade, this is central blade, and it has holes in it, and we can fix through its holes it into the remaining two blades, or remaining two blades that are underlying it. And it has somewhat coin like handle. Remember it as well, it has two screws here. Okay, in your Ospe, this is again Killian's nasal speculum. Okay, in your Ospe, they can also give you the spare parts of Lempert's and oral retractor, so you must know about its features. Like it has coin like handle and it has two limbs, and here is the central third blade, and these are two lateral blades. Okay, and then another picture of Lempert's and oral retractor. Okay, Now let's move towards the mastoid couch. Here is the mastoid couch, and in the case of the mastoid couch, it has two parts mainly. One part is that it has a metallic hand. Sorry, this is its metallic handle, and here you can see that it has a cutting end, and this it has actually a curved rounded tip. Okay, curved rounded tip, and it is mainly used for cutting the bones in a circular manner. Okay, yeah, like its uses are it is mainly used in mastoidectomy, but it is mainly used to remove the bone. Okay, here you can see another mastoid couch. This is Mollison mastoid retractor, but remember it differs from Jansen's mastoid self-retaining retractor as it has also two prongs, but it has four teeth. Okay, on its end. Each prong has four teeth on its end. Okay, so it also has a screw. It is Mollison mastoid retractor. Its uses are same as I have mentioned in Jansen's mastoid self-retaining retractor. Both of these mastoid retractors are mainly also called hemostatic. Why are they called hemostatic? Because they also stop the bleeding. Their purpose or their use is not only to retract the soft tissue, but they also stop the bleeding and they allow our both hands to be free. Okay, this is again Mollison mastoid retractor. Here you can see its four teeth. Okay. Okay, so the next instrument here is Lemperts curette. You can see that on its handle, here are some striations are present, and its end is or its tip has somewhat spoon-like shape. Okay, here you can again see in zoomed out picture that its handle has some striations present in it, and its tip has somewhat spoon shape. Okay, and it's in Lempert's curette. Why we use Lempert's curette? It has rounded large handle, you can see as here mentioned. Okay, and its uses are that it is used for mainly curating the bone, or we can say that chunks of bones are broken into small pieces during mastoid and ear canal surgeries like tympanoplasty, stepidotomy by this Lampert curette. Okay, now let's move to forward towards the other instrument, that is Macwens curette and cell seeker. Here you can see that it has a handle in its center, and it has two ends, and its one end is somewhat probe like and its other end is somewhat spoon like. Okay, here you can see it zoomed out picture that it has somewhat spoon shaped one end and its probe like other end. Okay, again you can see here that it is Lampert's curette or scoop that has handle with striations, and on its tip it has somewhat spoon shape, and this is Macwens curette and cell seeker, and as its name indicates that it is cell seeker, so it is used for the exploration of the cells in mastoidectomy. And number two, as its name also indicates that it is curette. So it has somewhat function like a curette, that it is mainly used for to curate the intervening septa and bony granulations in mastoid surgery, and with its other end we do mastoid ear cells exploration. And here you might confuse it with freer elevator double-ended freer elevator. It is mainly used in septoplasty, but its handle is somewhat, I may say in layman language, that its handle has granulations over it, and its two ends are elevated. Okay, its one end is elevated like this and the other end is elevated downward. One end is elevated upward and the other end is elevated downward. It is not like that Macwen curette and cell seeker, which has one end as spoon shaped and the other end was just like a probe. Okay, this is another picture of the freer double-ended elevator, that its one end is just like that. One side of, like we take zoomed out picture of this end, on one side it is just like this and on other end it is just like this, and same happens on its other end. Okay, so this instrument is Farabeuf periosteal elevator, and it has one handle as you can see here, and on its other end it is somewhat curved, maybe curved or maybe straight, and it has somewhat striations also present on it. And this instrument is also used in mastoidectomy, as its name indicates that it is periosteal elevator, so it is used for elevation of the periosteum from the mastoid cortex. Okay, so here again you can see that this is Farabeuf's periosteal elevator, but this is straight one and this is curved one. Okay, this is curved one right here. So let us take a review from Shruti Dhingra as well. Okay, you can see from here that it is Myringotome. This is Mollison's mastoid retractor with two prongs and four teeth on each prong. Jansen self-retaining mastoid retractor, two prongs and three teeth on each prong and coin-like handle, but it is somewhat scissor shaped. And again you can see from here that this is Lemperts and oral retractor, two lateral blades. Okay, these are used for retraction of the tissues of flaps, and central blade with holes, and this central blade is used for the retraction of the temporalis muscle. Okay, and it is fixed through its hole into the underlying two blades. And then comes Lemperts and oral speculum. Okay, and it is somewhat, it has two limbs, one screw, and these two limbs end into curved blade, and then it ends into hollow cylindrical tip, and this tip is, its blades are not very much long like in Killian's nasal speculum. This is mastoid gouge. Okay, this is its handle, and on other side it has somewhat rounded tips, curved rounded tips, and this is Lempert's curette. Striations are present over here, and it is scoop like, and Macwens curette and cell seeker. Okay, one handle, and the on one tip it has probe, and on other tip it has somewhat a spoon like shape. This is Farabeuf's periosteal elevator handle, and its striations are seen here, but it is mainly curved Farabeuf's periosteal elevator. Don't confuse it with Tilly's harpoon. Don't confuse this Lempert's curette with Tilly's harpoon, as we will discuss it in the next video. Okay, and here is your Freer's double-ended elevator. Okay, and you can see that it has a handle, but somewhat granulations or somewhat rough structure of its handle is there, and on both of its tips it has scoop-like appearance. Okay, so that was all. Thank you very much.